ki khubor ka bate si TV. Lawan Rashaphi da ka Frank Motors. Visit Frank Motors or call 7045207973.
MIT University of Meghalaya. Our admissions are now open for the academic year 2024-25. Explore our best courses. Experience global collaborations. Apply today.
Step into paradise at Mausentelang Nongwar. Your sustainable escape into nature's heart.
Ka Indian Medical Association Meghalaya State Branch kala ajeng Kyrshan ba ka jila Meghalaya kala Debandon la ka jong Medical College kenamakan nong ka buksia ri samla puli doktor bat ba ka jila Meghalaya kenyo la ki jong doktor ki balak ban a ya ki syakri ki bapaka shiki bat ba nong nong jong ni ka jila yakni lapen paudu Professor C Daniela wadi President jong ka Indian Medical Association Meghalaya State Branch but ubelongru Medical Superintendent jong ka Nigrims Hospital habakran ha 23rd Scientific Conference kam General Body Meeting jong ka Meghalaya Medical Services Association kablalong ha State Convention Center Shillong ha ka sing thoding ka laitrik jamang arajar pusau Hakni ke jingalang la ishim bentalang du Principal Secretary jong katanak koi kakya ka Sarkar Jilla Usampat Kuma ublalong kumu kongsan u President jong MMSA Dr. Macmillan Surong u General Secretary Dr. R. Postnem bat kiwe ki Dr.
I would like to highlight a few of the challenges we are facing in the healthcare sector today. Foremost in the list is the challenge to provide our clients with high quality care for any health problem. We have never paid a lot of attention to quality service before. However, with the increase in awareness of people with regards to health rights, we have to work towards meeting the expectations of our clients. This will help to build trust and loyalty. Next is the absence of systems or poorly designed systems which resulted in the lack of integration which is apparent across sectors and individual healthcare organizations. This will lead to failure in delivering patients' need. With the rising global rate of mortality related to non-communicable diseases, we are facing many challenges in treatment and meeting the needs of the chronically ill patients. We have to be able to provide the full complement of services needed and treatment which needs to be continuous in all settings. Another important aspect is information and technology. IT can bring about a significant transformation in healthcare system with potential contribution including enhanced clinical decisions by making real-time data available. We must ensure that our healthcare facilities make optimal use of it. Shortage of healthcare professionals is also a major challenge in our state, especially in the organized stream. Effective deployment of the existing professionals need to be addressed to improve quality of care. There are a lot more of challenges we are facing and yet to face. But coming and working together will bring success and progress at all levels.
MMSA are the pillars and backbone of the healthcare system in the state. And together with Nigrims, the non-government hospitals, and with all the members of the MMSA, we have been working together as a team, synchronously delivering healthcare system to the entire state of Meghalaya in times of need, in times of trouble, and in times of very important things. So I'm extremely happy that being in a medical college, being a teacher of medical college, that we have finally decided to have a new medical college in the state, which is very much in need of the hour. And because this will provide a very much needed local health manpower for the state. And In fact, I was very much in favor of having a state colleges. In fact, in one of the media that has been, one of the prime media has put why the state government should come in the state instead of the central government. Central government has a role to play too. But then if you look at the reservation policy of the central government and state, so if you have a state government medical college, I think lion's share of the seats and the employment goes to the state. So I'm very happy that Slate, nevertheless, that there's a decision to make a state medical college. So Negrims can have we can lend a helping hand in fulfilling the desire of the state in developing faculty so that they are qualified according to the watchful eyes of the NMC, where that is a supreme power of medical education in the country. So we have in Negrims running recently Regional Training Center for Faculty Development program, one of its kind in the entire Northeast, which has been set up by the NMC. I think this will help us a lot in fulfilling the criteria of the NMC so that we will be qualified to run a medical college, so that all our people who have been trained are recognized by NMC. So I'm also extremely happy to know that recently the state government has started a 2-year diploma postgraduate courses in different fields of radiology and anesthesiology in Civil Hospital Shillong, which has been run by NMC, by National Board of Examinations. I'm quite happy because the existing facility can be used. These will be a trained, recognized postgraduate the specialists which can be used in the entire state of our state. Because I've seen that there's a lot of, I've been having interaction with a lot of the administrations and officials of the state government. So they always say one thing about the lack of manpower, especially the specialist manpower in the primary health center, dispensaries, the CHCs, and even the district hospital, which because of, I'm really grateful that the facilities like MHI system exist. I can see that when I was talking to the doctor from the Ganesha's hospital, he was so grateful that he has got everything what he wanted from MHIS, the infrastructure development and the manpower. I think this has got a long way. Whatever has been required by the local facilities is being fulfilled by them without going to the hassle of getting to the maybe higher powers. So that all the things can be done. I'm quite happy that this is transforming the entire health facility of the state by giving incentives to our doctors and the paramedical staff that work in different parts of the state.
May I request the member of the House to give a big round of applause to our respected and honorable chief guest, Sir Sampath.
Anyone can be, dispensable, but the doctors are indispensable. So maybe that could be the reason. I think I think all of you are saying at the end, "Long live MMSA." So if you live longer, then the people will live longer. So the important, I think that's the purpose of this entire association, the purpose of this entire the today's function, right? How actually we can provide that long life, productive life, healthy life to the people of the state. I think with that mission, the health department has been working, and today we are working together. That's the beauty of this that today there is a collaborative work, there is a collaborative governance, not only within the health department, but also we are also working with all other departments. There is a greater intersectoral collaboration is happening There is a greater community participation is happening. A lot of systemic reforms have come up. For the first time in the country, there are elected village health councils have come up. So there is a greater participation from the communities are happening, and there are a lot of initiatives like Meghalaya Medical Services Recruitment Board has come up, so that like on an annual basis we are able to recruit the doctors. So we are able to get some Meghalaya drug corporation has come up. I wanted to tell you this one today when I was looking at the presentation with the Government of India, the Secretary to Government of India. They have shown the slide which actually the NHSRC has done a study to see how the drugs are available to the people at the end. They made a big study of 18 states. Meghalaya is the outlier. 93% of the population they reported that they are receiving the drugs. So all that happened again during the last year, 2023, because that year we got the corporation. So when you have a kind of when you engage in reforms, when you engage systemic efforts, definitely they will lead to a different kind of an outcomes. Similarly, we have done some very interesting work. I really like to share, and I like the MMSC also has given a letter to Dr. Fira when she was leaving. When she was the chair of this, she sent a letter to the Department of Health saying that we really appreciate the work that is happening, and we really wanted to continue this work, especially the work related to saving the lives of mothers and children. Today the state has consistently, with all the doctors, MBOs taking leadership role at the remotest places, and all that led to almost a close to 50% reduction in the maternal deaths compared to the last 3 to 4 years. So that is the sharpest decline. So all these are happening because there is an intrinsic motivation. There is a different kind of a purpose with which actually everyone has been working. I think we should continue this because this is going to give a good example, to the entire country, not only entire country, entire world. So as all the state is also in the process of these medical colleges. A lot of doctors are required, a lot of specialists are required. So again, we are working closely with the NIGRIPS, where where the senior residentship, like additional training that is required for the specialists to become the faculty, that also can be facilitated. So these are some things that that are happening. So I thought I just also share these few developments with all of you.